staff, and guests. The lobbies are open and the recording will begin.
Thanks, Justin. Good morning, everybody. We will convene the Washington State Liquor and Cannabis Board Caucus meeting for October 11th, 2022. Our first item on the agenda today is to have a presentation on a study by Seattle and King County Public Health and Washington State University on youth perception of cannabis product packaging. I just had a chance to read it myself through this morning. It's pretty interesting, and I'm going to turn it over to Mary Sagawa, our public health liaison, and she can introduce the panel and get us started. Mary.
Great. Thank you so much, Chair Postman. Good morning. Good morning, board members Wallendorf and Garrett. Thank you for this opportunity today. I want to give you just a very brief background and then turn it over to our guests. In February, I received an email from Sarah Ross-Wiles, the Youth Cannabis Prevention Program Manager at Seattle King County Public Health. She was reaching out to us because she had 3 proposals from researchers, Drs. Willoughby and Hust at Washington State University, and she and they wanted our feedback on those 3 proposals to look at youth appeal in cannabis packaging and labeling. And so Becky Smith and I met with them, gave them some feedback. And so today they are here to present the results of the study that they completed. So at this point, I will turn it over to Sarah to do a little bit further introductions and for the research report. So thank you.
Thank you, Mary. And I'm going to only speak really briefly because it's actually Dr. Hust and Dr. Willoughby who will be presenting the findings from the study. But just to give some context of why we wanted to take a look at youth identified appeals of packaging. So what youth themselves said that they would find appealing about cannabis product and packaging. As we all know, the legal market is a very new thing, and research within it is pretty small around what packaging means. My background is in tobacco prevention and control, where there's great understanding of how much that package means and what it is intended to do and how powerful marketing can be. And we do have, as you know, codes in Washington State that are about limiting the appeal, reducing the appeal for young people, but we had not yet had an opportunity to really center the impressions of young people in their own words and their own perceptions of what those appeals looked like. So this work with Washington State University was a first step in doing that. We'll get into the methods more deeply, but I just wanted to give that context of why this work was important to us in King County. And since these codes affect the whole state, we decided to take a statewide approach in involving youth. So that's the background for why we started this as a project. And as you'll hear, we're in phase 1, and we'll move to a phase 2 that looks more closely at how much of what we heard from youth and focus groups relates to youth throughout all of Washington, a bigger sample, and also how packaging and perceptions of warning labels might feed into intentions to use or susceptibility to use. So with that, I'm going to hand it off to Stacy Hust and Jessica Fitz-Willoughby from the Merrill College of Communications at Washington State University for their presentation. I really appreciate that they could join us today.
Thanks, everyone. So thank you very much for having us here. And oh, I lost the slides, Jessica. Are they up? Maybe I just can't see them. Okay.
I lost them too.
All right, as she's getting those ready, I'll just go through the first couple because it's just really the first 2 are introductions to us. So our title of our presentation is Youth Perceptions of Cannabis Product Packaging. You've seen the report and you've read a little bit about us. So go ahead, Jessica. Our work is housed in the Murrow College of Communication. Jessica and I co-founded a lab that we call the Media, Adolescent, and Cannabis Research Group Lab that houses a number of graduate students as well as individuals who are working on the project. We have had funded projects from the Dedicated Marijuana Accounts Grant, from the Washington State Department of Health, and then also from the Miller Coors Great Place Grant Program, which is primarily focused on alcohol. We are mixed methodologists in that we do both qualitative and quantitative research. We've done research in the area of cannabis that includes in-depth interviews and focus groups, quantitative surveys, and experiments. And one of the key components to the work that Jessica and I do is research mentoring. We are keenly aware that we need more people doing this work across the country. And so we take our training of our graduate students very seriously. Our research team has attracted now 2 doctoral candidates, 4 doctoral students, and 1 master's student. And we have more who are requesting to join us. We actually don't have capacity because we're currently full. But it's exciting that there are so many students interested in doing this work. Go ahead, Jessica. So just a brief discussion of our previous studies. So we've done multiple studies in the area of cannabis and advertising. And that's actually where most of our research has been done, is cannabis and social media advertising and cannabis and advertising into more traditional outlets. So we've published studies in youth's exposure to marijuana advertising and its association with their marijuana-related beliefs and behaviors, young adults' cannabis-related social media intentions to use and cannabis use, and the effects of cannabis advertising with risk portrayals on young adults' attitudes and intentions to use cannabis prior to sexual activity. I will state that in some parts of our presentation, we will use the term marijuana only because that is the term our participants routinely use. We've actually done a large-scale survey where we've asked people what they refer to this drug as, and most of them use the term marijuana still. We are keenly aware that marijuana has negative connotations, and whenever possible, and now in all of our publications, we use the term cannabis, but we do note that our participants prefer the term marijuana. Go ahead, Jessica. So to talk briefly about one of our studies that just sort of situates and provides a context for this larger work and kind of why we got involved in cannabis work to begin with. We received a dedicated marijuana account grant to look at proximity to retailers, youth proximity to retailers, and whether that was associated with their exposure to advertising and their intentions to use cannabis. And we worked with, actually, your board, we worked with Mary, who provided us with a list of the retailers that were in Washington State, and we created a variable that was the number of retailers in a young person's zip code. And we surveyed 350 teens in Washington. This report is published in the Journal of Health Communication. We found that the number of retailers in a participant's zip code was not significantly associated with intentions to use. I will clarify that more recent research that has used different measurements for proximity of research have found contradictory findings. And we imagine that their research is equally valid. We think it's in part due to our measurement of zip codes, which are fairly large in Washington State. What we also found, however, was that perceived proximity to retailers really mattered to adolescents. And it was significantly associated with their intentions to use, and it interacted actually with their exposure to cannabis advertisements. So what that means is our research found that if you thought you lived closer to a retailer, you were more likely to intend to use. Didn't matter if you actually were. And so that has real importance to advertising that can be found, far away from retailers, might be found in lower socioeconomic status communities, might be found in more rural communities, even if a retailer is far away. And then adolescents who truly lived far away from a retailer, but who perceived they saw a large amount of advertising, were more likely to report the intentions to use. As we turn to our discussion of packaging and labeling, we're going to go through this really quickly because you all are the experts here, and we're just gathering, how youth make sense of these materials. I also want to note that you can feel free to interrupt and ask us questions during the presentation. Please do not feel like you need to wait until the end. So as you all know, there's cannabis packaging and labeling resources. When we worked with Sarah, one of the things that she asked us to specifically look at was the both of the warning labels that are consistently on cannabis packaging. So the not for kids label, and then the cannabis label that indicates it's for 21 years old or older, and that the product includes cannabis. And so we included an investigation of youth's perceptions of those warning labels in our focus groups. And then go ahead, Jessica.
Thank you, Stacy. And as Stacy mentioned, we'll go briefly through this, but as you know, there are rules around things that can't be already included in there, like bubble letters, cartoons, or celebrities or models that are appealing to youth under the age of 21. And additionally, the guidelines are a bit more general in some areas, right? Products cannot be especially appealing to persons under the age of 21 with some more specifics. And then really this kind of came out of this idea of what are they finding appealing? That's what we're trying to figure out here. So that leads to our purpose in the current project. Youth perceptions have just not been systematically examined to help us really influence the policy decisions that you're making. And we appreciate that we have this opportunity to look at this perspective from youth and kind of hear what they're saying as well. We wanted to better understand Washington State teens' perceptions of cannabis product packaging appeals so that we can really see what they're thinking of the packaging, as well as understanding the interpretations from how they're perceiving it.
So we first gathered information, and this included our team members needing to be better versed in cannabis products. So we actually coordinated with a person who markets cannabis products. It's been her career for a number of years. She's actually one of my former students. And she came and presented to us on all of the variety of cannabis products that are available in Washington State that she was aware of. We then asked her to provide take some images of products for us that were available locally. We actually thought that while she did a great job of teaching us about cannabis products, she wasn't a great photographer. So we actually asked one of our research assistants to go and take professional photos, and we'll show those in a minute. All of the photos of the products were taken with a 360-degree perspective. So we included both the front and the side and the back of each of the products. We then conducted virtual focus groups with youth. It was important to us to include virtual focus groups because both for cost effectiveness, but also as a way to make sure that youth would participate. It's been harder and harder for youth to engage in in-person activities since the pandemic. We then, because we did virtual focus groups, we had Zoom transcribe the focus groups, but we didn't just trust Zoom's transcription. We also verified those transcripts. And so we had a member of our research team sit and listen to each of the focus groups and make sure that the transcript was accurate. And then we conducted thematic analysis of those transcripts. So in the next slide that Jessica is going to show you, you can see one of the images that we gathered, which is from a Marmez Blue Raspberry. And you can see that it was really important to us to just present the product. So everything was against a black background, and we just presented the product as it is. So it's not in situ. We didn't have it on a shelf or anything, but it's literally just the packaging itself. Go ahead, Jessica.
I'm sorry, could I ask a quick question?
And
for sure.
Please. All the pictures you're showing are things that were bought in a regulated store in Whitman County, right?
Yes.
Okay, thank you.
Yes, and so to tell you a little bit more about some of those methods as well, as we mentioned, we did virtual focus groups with youth. This included having us talk to 28 youth total across the state of Washington. You can see here on this map the counties in which we talk to youth, and specifically the cities are in blue for the cities from which youth participated in our focus groups. We also had some in-depth interviews as well as focus groups. A small proportion of youth were individually interviewed so that we had information from them kind of one-on-one, as well as the broader consensus building that happens in focus group discussions. But all of our group discussions were kept small at around 3 or so youth with a moderator and a note taker in there. That way we could have them really engage in discussion because they were virtual. They could then see everybody and still engage and see the products as well as part of that effort. You'll also see that we tried to get a large variety of areas covered in the state of Washington represented here. We recruited through contacts that Sarah had and youth group organizations. We also used our own contacts and looked at organizations and clubs and schools, as well as some prevention organizations, because we didn't only want youth who were involved in Teens Against Destructive Decision groups or things like that, but other broader representation as well. And we tried to recruit minority populations and LGBTQ adolescents who are often targeted with some of the advertising messages around substances, but may not be involved in some of these discussions as frequently. So we did end up getting oh yes, go ahead.
Thank you. You actually answered several of my questions as you were talking just a moment ago, but I had a question about the 28 youth. Is that the sample size that you were hoping to get? Were you hoping to get larger? Were you satisfied with that? And then geographically, I see like Clark County, for example. I mean, how do you feel about the geographic reach that you actually obtained?
Great question. So we originally intended to try to recruit 30 youth, so we were slightly under. Our discussions were very in-depth though, so I would say that we had more than an hour and a half conversation with the youth involved in our focus group. So we actually had large amounts of data because they looked at multiple product packaging in each focus group and talked about their own experiences and understanding of the packaging. So while 28 may seem like a smaller number in terms of some samples, it's actually very rich data that we received from the youth in terms of what we had there. And we were satisfied with the sample. We believe we reached saturation in terms of the information we were receiving because towards the end, we were getting the same information from new participants, essentially. In terms of the geographic location, we were actually quite happy with how we spanned the areas. In addition to this, I don't know if it's as clear from the visual, but we tried to hit some urban areas, some more rural locations, and I feel like we did that very well with our recruitment efforts. We really wanted to have a wide variety of people who were in cities and might be closer to retailers, as well as in areas where they might have a lot less of that access or that proximity piece as part of their influencing factors there as well. We also had a wide variety of people with differing experiences in cannabis, and so we'll talk about some of that when we talk about our findings more generally. But I think that overall we were quite satisfied with that. Were there other questions to that I didn't respond to? Okay, excellent. And Stacy, was there anything else that you wanted to mention on this slide before I move on?
No, the only thing that we would add is that we have to be really cautious because this is a qualitative sample, it's contextual data. We've not gathered anything generalizable here. Jessica and I are keenly aware this is 28 is a great sample for a qualitative study, but that is why we are pursuing phase 2, is so that we can take this to a much larger sample and gather information that will hopefully span the entire state. And will give us a little bit more information about how not only does the rest of the state youth, or at least a sample of them, see these same appeals, but are these appeals connected to their intentions to use?
Thank you. That's helpful.
Okay, so I'm just going to go over this really briefly. We conducted thematic analysis in order to analyze the data. So this is an important technique where you take qualitative data, you look for themes based on participants' quotes and their comments, and then you extrapolate from those themes, from those original themes to even bigger themes, and that's the themes that you found in the report. So this is a really rigorous way to analyze data, and we had multiple coders, so we have a good, strong reliability across all of our team for these themes. Go ahead, Jessica.
Thank you, Stacy. So we're going to talk to you about the findings now, the meat of everything that we kind of looked at here. And one of the first things we wanted to note was this idea of an overarching theme that we recognize. So across all the different packaging that we kind of showed the youth, we noted a few things, specifically their varying levels of knowledge. And this really came from their own experiences in some cases with cannabis. So there was varying levels of knowledge in terms of access locations. We had some who were very novice in terms of cannabis and thought they could just go to the grocery store and pick it up at the checkout counter. Very different than what's actually out there. And then we had others who were actually frequent users of cannabis and talked very specifically about the strains that they had used and how they were using the product in their own lives. So this level of knowledge that teens had really impacted their understanding of product packaging, and we kept that in mind in terms of our analysis because not everybody has that level of understanding that some of them showed. Additionally, this also was impacted in terms of their serving size information understanding or things like that. If they were more familiar with the product, they tended to be more aware of how much of a product was in there. We also noted that their past experiences with media literacy impacted their interpretations of the packaging. So media literacy is the idea that one can be a critical consumer of media and the information that they're exposed to. We had some adolescents in our sample who seemed very media literate, and they recognized that here's how packaging is done to try to be appealing, and they're using these specific things to try to get me to pick up their package versus other packages in the store. On the other hand, we had a number of individuals who were not very media literate and didn't really recognize some of those appeals, but just reacted very genuinely to what they saw at their initial outset of information that was available there. So one of the things that we found, one of the main findings was that bright packaging was seen as appealing to youth. They really thought that if a package had a lot of bright colors, youth would find this appealing. So you can see here one of the quotes. I would say definitely teens. We'd ask them who they thought these packages would be appealing to. I don't think it's really marketed for young adults, like people over 18, just because of the color. It's kind of obnoxious, but it's very bright. It's very out there, but I think definitely teens and adolescents. And we saw this with a number of the packages, that if they had these bright colors, the youth tended to say that it was something that they would find appealing to them personally or to others in their age group. Related to that, oh, sorry, was there a question?
Yeah, Dr. Willoughby, do you know, I know not from this study, but in general, like, so the teens quote there about, you know, it doesn't seem to be designed to appeal to older people. What do we know about what appeals to adults? Might they find it also appealing, or is there any science up behind that we know of?
Yes, so that is a wonderful question, and one that doesn't have a great empirical answer for you yet,
Okay.
unfortunately. I wouldn't say that there's a cutoff on what makes something appealing to adults but not appealing towards children. So I think there actually is a lot of overlap, right? Things that they might see as appealing to them still might actually be appealing to an adult audience. And that makes it kind of very messy, unfortunately.
Mm-hmm. Yeah, thank you.
Mm-hmm. So the other piece that was related to this that they noted was that bright packaging can obscure the warning labels in some cases. And so one of the examples you see here was of the fruit chews. And the warning labels up in the top, it kind of had a similar color because of the large watermelon color in this case. So you see here the quote specifically, I just think that there's too much for them to draw away from anything, like too much going on the label for them to draw away. So they're really talking about here, because of the coloring, it blends into the packaging and they might not be as perceptive to what was presented there. Additionally, here you see this one talks about visual cues and how they find them appealing. You'll note that some of these had the brand logos, which could be considered somewhat cartoony, but that's not actually the piece that the teens were commenting on mainly in these types of packages. So while the mammoth could be seen as something that would be appealing to them, we're really noting in a lot of cases that the visuals of the product, like the strawberries and this idea that it was fresh and the logo as part of that, was something that they found appealing. So you see here a conversation that our participants were having. These are all anonymized, so these are different names, but they said they loved that one, right? They liked the strawberries in it specifically, and the strawberries, but also the design was really cool. But the strawberry is what made it stand out to them because it would taste good, and they liked the flavor of strawberries. And so the report talks a little bit more about some of this as well, the role of flavor as part of that piece. But we recognize that this is also an area that's very complex, because a flavor that could be appealing to a youth is still also a flavor that could be appealing to an adult. And so we know that that can be confusing and problematic in some ways for how that could relate to some of these findings.
I have a quick question. Can we go back 2 slides?
Yes.
And then, so looking at that one and then move forward 1 slide. So just looking, I have a question about bright. And what did you guys talk to the participants about definitions at all? Because when I look at the previous one, it's white and it's very, very bright. And then I look at this one and it's darker, but you know, the colors, I guess. But anyway, I just have a curiosity around definitions related to bright.
That's a great question too. I'm off the top of my head, I know that we usually ask them, like, could you expand on that? Could you tell us what you mean? What's your definition here? So my interpretation would be that it's really about things that stand out, right? So even though the background is dark here, the bright colors are brought to the forefront. Whereas in the other one, I think I'll go back briefly, so bear with me. In this one, right, the bright colors are swirly, but they're still there and having these differing colors. So I think it's about the contrast in some cases for them. Stacy, did you have anything to add to that?
Yeah, no, I agree. And I think they use the term bright interchangeably with some other terms too, right? Like attractive, cheery, cool, right? Catch their attention. And they likened these products with products that they would see in particular areas, like in a convenience store. And it would be the things in a convenience store that are meant to catch their attention. So some of our participants were quite savvy with how marketers are making products to catch our attention. They likened these products in that same way. And so I think that's what they're talking about when they say bright, is it's actually a fairly loaded term. It means not just the colors, but the feel that they get from the product, perhaps.
Great, thank you.
Sure. So if we talk now about them making sense of warning labels, this was a really important discussion for us to have with these youth. And I'm interested and excited to see what phase 2 will reveal, because what our focus groups indicated was that the young people we spoke to thought of the warning labels as being applicable to very young children. So we're talking toddlers. They often referred to 2 to 3 year olds who a parent, if a child got a hold of the parent's edibles, the parent would clearly need to call the help number if a 2 or 3 year old got a hold of an edible. But they did not see it as something that was relevant to themselves. In part, this is because they felt that if they had consumed too much, they would just write it out. They would, what are you going to do? It's not going to kill you, was kind of their perception. So what would they do? They would literally just take the time till they got better. They also were not everyone in our focus groups were clear that the 1-800 number or that the call number went to poison control or to somebody who could help them. And when we asked them if they would use that number, most of our teens said that they would call either their friends' parents or their parents, and not the call number. Now, there has been some research done by some of our colleagues at another university that has shown that call number the use of that number has increased. And so I want to caution that our results aren't indicating that the number is ineffective or shouldn't be included. It's that teens need to know how to use the number, and that we maybe, if we're using it in order to reach teens, we're maybe at a disadvantage because we say not for kids, and teens don't think of themselves as kids. And so they immediately think of this as being for younger people and not for themselves. Go ahead, Jessica. So one of the other things that we were really curious about was the serving size. And this really came up in a variety of products. We're going to use in our presentation today the soda because it was the most blatant and it was the most misunderstood. But serving size misunderstandings happened with a variety of products. You all know that there are gummies and there are chocolates that are created and sold, and you have to cut those products up in order to use an appropriate dosage. And the participants that we had in our focus groups, very few of them understood that they would need to be cutting something up, or they would need to be taking a piece of a gummy, for example. But in the soda, overwhelmingly, participants thought that the serving size was the whole bottle. They thought you would drink the soda just like you would drink a Pepsi Cola or a Coca-Cola. And then they also talked about the nutrition facts, and they said there's nutrition facts on everything. I probably wouldn't take the time out of my day to really look at the nutrition facts. But Jessica, if you go to the next slide and hit one more time, this bottle actually has a ton of information. So this is actually a retailer that's providing a lot of information to its consumer, right? There's a caution label. There's a clear consumption advice where it says that this product may take up to 2 hours to have effects. So it's doing what we would want a product to be doing, but the consumers are not reading it, and then at least these teen consumers are not, and the teen consumers are not, the ones that we spoke to are not understanding that content. And then we were surprised that this bottle actually includes 10 servings. And so to use this bottle, what you actually are supposed to do is to dole out a portion, put it away, put it back in the refrigerator, and wait for another day, and then use a portion again. And the teens that we spoke to did not understand that. And there was some discussion that if they found this bottle at a party, if it was on, a counter, they would just assume that they were supposed to drink the whole bottle, which I think is important for us to think about the implications of that. I've done a lot of research with teens, both my dissertation, and then I published a book where I went into teens' bedrooms and looked at how teens are using media in their private spaces. And it is really common for teens to use advertising in their personal bedrooms as a way to kind of show not only their product affiliation, but it's a really cheap way to decorate your room, right? I was surprised, however, that our teens talked about using cannabis product packages as decor. And so we had multiple teens who talked about using the products that we showed in their rooms as decorations. And then, of course, what we were less surprised of is that they saw these products as things they could put in their social media. So we actually had one young woman who said, we're taking like a picture with that drink, talking about the Blaze Orange. That is such a cute like photo shoot drink, right? And this is not a participant here, but this is an image that we've purposefully selected because this is how teens communicate about what they like and what they think is cool. They're taking pictures of themselves, they're posting it on social media. And these teens very much thought that the cannabis products would be an asset in that image making that they're attempting to do and in that identity formation. Go ahead, Jessica.
Thank you. So we want to talk just briefly about the implications for public health and then also the implications for policy. And essentially here, what we noted, right, was that while these teens in particular are not the target audience of these packages, right? They're not the ones who are supposed to be in these stores purchasing these products. They recognize that if they were somewhere public where they had access, like at a party where somebody put something out, they wouldn't necessarily check for information on the packaging. They would just enjoy what was there. And so we think that maybe encouraging some level of basic knowledge around cannabis could be important if they're going to be potentially exposed to products or these pieces of product packaging that are out there. We also think that media literacy training could be important here, including media literacy specific to packaging. So why are advertisers or marketers using the appeals that they're using, but also how can we interpret the information that's presented on those packages in a way so that they can make sense of that information and know what they need to know to reduce potential negative outcomes and harm there. And we think really, again, that there's just this critical need to further our understanding of the dynamics between packaging appeals and youth cannabis product perceptions. So as we noted here, right, we don't have information still yet on if this leads to greater intentions to use or actual use of the product. We just are understanding their perceptions of the packaging and what appeals to them. So the outcomes associated with that are less clear, and having a better understanding of that could be helpful for future public health efforts as well.
We have a question or comment from Nicola Reed in our licensing division. So let's have Nicola join us.
Hi, thank you. It's nice to meet all of you. Just one question. So our state requires that no serving be over 10 milligrams, and they do have to be individually wrapped in 2 mil or less. So what the teens thought that they would be up to 100 milligrams per edible, or they would have to cut them from there, because unlike other states, we don't allow a serving to be more than 10 milligrams THC.
Mm-hmm. So I think in some cases they recognize that. Some of the packages we included were clear, like there was a package of pretzels. I don't believe we had it in this presentation, but it had a clear front. You could see that the pretzels were individually wrapped. And so they were able to say, like, we recognize that would be something that we would need to know more about, right? Like if there was a bowl out with pretzels at a party, they're still going to be individually wrapped. Nobody probably took the time to unwrap them all. They were like, we would kind of think, yeah, that's interesting. Those pretzels are wrapped individually, right? And maybe recognize that as a barrier to consuming the product unknowingly, for example. Some of the other products, though, like the sodas, they mentioned like that would be something they wouldn't necessarily know on. And so I think it really depended on the type of edible and how they saw it, because similarly, certain things like gummies or like the Starburst type candies, even though they're individually wrapped, most kids don't sit down and have one Starburst chew, right, when they have a package of the candy. And so for them, if they saw something out like that, even though something's individually wrapped, they could, in their minds, see that as a normal type of product that would be something you would consume multiples of.
Okay, thank you for that. Oh, go ahead.
Oh, sorry. I think I would add too that this is their interaction about serving size is less about the product and how it's packaged and more about their ignorance of how to use cannabis, right? And so it's their unawareness of how cannabis works, how cannabis edibles are packaged and used, that is really the issue here. It's not necessarily about the packaging itself. It's about the teens not really being informed about this. And there's an issue there, right? We don't necessarily want them informed because it's illegal for them to use. But what Jessica and I found in these focus groups and what we hope to investigate further in our survey is it may be that we need to inform them even though it's illegal for them to use because they're getting access, right? We had focus group participants who readily told us out of the 28 kids, we had people who were using and who have used cannabis edibles before. And I imagine we'll find that, in our statewide survey as well. And so we may have to think about, okay, this is illegal for you to use, but you may be at a party, you may have parents that use, you may go to a friend's house, it may be out on the counter, and we need to help them be good, solid consumers and educated consumers. And ideally that would mean they would abstain, right? But we can't also be idealistic about that.
No, thank you. I really appreciate your answer. And then my only other question was for the packaging that teens found to be pretty or colorful, was there any follow-up to see if the colorfulness would entice them to consume? So just was it pretty, or was it kind of like leading them to want to try the product? And that's my last question. Thank you.
Yeah, that's also a good question. In the focus groups, we didn't really get as much into their intentions to use. in part because of also the way that data were collected, right? They were very identified in that data collection effort. And so while some still readily admitted their access and use of the product, others were much more hesitant on some of that, which is recognized because of our methods, right? They were in group settings. We couldn't guarantee confidentiality when you're in a focus group and anonymity. So we really didn't ask them specific questions about their intentions to use based on that. We're really hoping that the survey will allow us to get at that more by letting us look at youth in a way that also protects their privacy in a way that keeps them safer in that regard.
Thank you so much.
Okay, so Jessica, do you want to talk about this or you want me to?
No, I'll hand it back to you, Stacy.
Okay, so there are also some implications for public policy here. And again, some of what Washington State is doing is really great, right? So either offer edibles in single serving doses or continue to clearly identify serving sizes and dosages on the outside of the cannabis product, increase and improve the labeling that makes it clear that cannabis is included, and appropriate warning labels. And again, we just need greater understanding as to how young people are making sense of those warning labels, and then consider other aspects of product packaging that perhaps haven't been considered, like product names, colors, and visual elements. For our work, our next steps, and go ahead, Jessica, to move to the next slide. For our next steps, we are working with Sarah to create a steering committee of youth that will provide feedback on these findings, as well as assist in our survey development. We very much want this to be youth driven. We will then conduct a statewide survey of youth to determine perceptions of product packaging and hopefully identify if they're associated with behaviors like intentions to use. Through the course of this work, Jessica and I have become even more convinced that there needs to be cannabis product packaging literacy training for both youth and young adults. As a complete aside, Jessica and I met with our alcohol, tobacco, and other drug abuse prevention and recovery expert here on the WSU campus. They actually initiated a meeting with us based on a presentation we gave nationally to a different organization. And they're talking about cannabis in very different ways. They don't necessarily have the awareness that we would need them to have in order to truly do their jobs well as it relates to cannabis. And so they came to us and identified a real need, not only for them to be educated about cannabis products, but also of age adults on our campus to be educated about cannabis products. And so we think that there is a greater need here for a packaging literacy training that would go to young adults who are maybe out of state, who are coming in at colleges and moving in here, new and maybe didn't have it legalized in their other state, or also just maybe who are of age now and are interested in engaging and using cannabis to do so responsibly. And then, of course, that packaging literacy and product packaging literacy needs to happen with young people as well. And that's everything. We provided our lab email, and then both Jessica and I have WSU emails that you can feel free to reach us. We're also happy to answer any questions that you have that you haven't asked already.
Great, thank you both, and thanks to Sarah and Mary too. Rick Garza, our executive director, has a question. Rick.
Thank you, Chair. Thank you for providing the information today. Just a couple of questions, and I heard you talk about the youth committee. It's something that Jim Vollendroff, is one of our new board members, has talked about, and how we might be able to do that also in our agency. But you had talked about, and I don't think you had an opportunity to look at our WAC, which is 314-55-105, which really goes into detail. What do we really mean by the term especially appealing to children? Because earlier in the conversation, you talked about the dilemma that we've had, which is it can be appealing to youth and to kids and to teens. But that's why we were very clear in writing the WAC that we said especially appealing. And then several years ago, we amended our WAC, which I just spoke of, to be very clear about what we believe especially appealing is. And if you look at the WAC, you'll see use of cartoons, bubble type, or other cartoon-like font, and it goes into specifics. So I think because of the work that you've done, it would be great at some point for you to look at that rule and tell us from what you heard in these surveys and focus groups, what we could do to further clarify. Because I think it was difficult because you've got the industry on one side saying you're killing the industry by doing this. and then the other side saying, no, it's appealing. And the states have all done it quite differently around the country. Some have not done anything near what we've done. California comes to mind. And some of the new states have been very restrictive in what the packaging could look like. And I kind of feel like we're somewhere in the middle there, but I think the help from all of you to help us figure out how do we create more clarity with respect to that packaging and labeling so that, and I think you talked about literacy education. It needs to be for all consumers. So you're right, it's teens and others, but what we've learned in the last few years is it's a new product since legalization, even though it's only been here since 2014. Edibles and the like, other than medical, didn't really exist in the marketplace years ago. So I think you're absolutely right. I think consumers are easily confused and have no idea how to consume edibles, the concentrates, maybe everything but flower. But really appreciate the time with us today. Thank you.
Thank you very much. And I would say that Washington State has done really well, I think, at making it clear as you can, right? Bubble letters need to be avoided, cartoons need to be avoided. So I would applaud you as a citizen that you have done that work. And I just think what we're finding in our research is it is difficult, right? You have a really difficult job. You have to manage the marketers and the industry's needs with the consumers' needs and with youth's, youth prevention. That's a really hard, not enviable position that you're in. And so I hope that our work will help inform that work in the future, because again, we don't know what youth are finding appealing. I don't know that many researchers have asked this question, and we wouldn't have been able to ask it if it hadn't been from the support that Sarah's office provided.
Member Volendroff.
Yeah, thank you. Hey, thank you, Stacy, too, for acknowledging the hard work that we have. I think our licensing staff, I think the staff who make these decisions work really hard to make really good, informed decisions that are there to protect young people. So I do want to acknowledge that. However, it is difficult. It is difficult given the challenges and the influences of different groups, etc. And I wanted to just quickly make comments on something Rick said. And I think the whole idea of literacy amongst different age groups, all the way from children to teens to young adults to adults about various products is something that could be extremely helpful. We just had recently a symposium on high THC concentration products. Well, that's equally an area of knowledge that every age group needs to know about. So I really think that would be super helpful. I feel strongly about having youth involved in public policy and young people impacting public policy decisions. So thank you for bringing the youth voice to the table. And that's an area where I'd like to continue to have conversation. Rick mentioned that it's an area that I feel like the Liquor and Cannabis Board needs to explore is how do we involve youth in decisions related to tobacco, vaping products, alcohol, and cannabis. So thank you for your work. And I look forward to conversations about phase 2. I'm really eager to dive in there. And I would also like to just offer our licensing staff, myself, Mary, others, to be a part of the discussions about what that could look like too, so that we're not just sitting on the receiving end of a report, but also on the front end of the report, if possible, to help with decisions around design, etc.
Yeah, we would be happy to have the help, to be honest. Absolutely.
Yeah, and I'll just echo that is the intent, is to, get all the stakeholders involved so that, including youth as the key stakeholders, and also, as Mary knows, I email her a lot about the direction this work is going.
A couple of quick things. One, one of you, I don't remember, said at the beginning that you do a lot of work with trying to train the next generation of researchers. So thank you for that, because what you're hearing is we're hungry for whatever science might be out there, and it would help us as we develop this. The one of my takeaways from reading the report and listening to you today was just how much I don't want to give credit to the adolescents, but just how much more nuanced this is among them than researchers really knew beforehand. And that makes it even more difficult to try to regulate these things.
Mhm.
And as we've, several people have said, the overflow to what's appealing to adults and things like that, but it really argues strongly for what you suggest, and which I hope we can follow up on, which is some sort of education to be a responsible consumer of these things. Somebody had asked me this question, and maybe one of you know, do we do that for alcohol? Or is there responsible drinking education that students get in school?
Yeah, there is. Yeah. And actually, that was what was so interesting about Jessica and I's most recent conversation, because the individual at WSU was giving an alcohol presentation, alcohol reduction presentation to a local living group, so a sorority or a fraternity. And they said, well, this is really great, but to be honest, we're not drinking alcohol so much anymore as using cannabis. They said using weed, actually.
Yeah.
And so he reached out to us and said, what do I do with this? And our conversation started because he said, I know when I tell people how to drink responsibly, I say consume this many drinks in an hour for your weight, right? There's that whole ratio. He said, that's old hat. I'm accustomed to doing that. He said, what do I tell people about cannabis? And I said, well, that's a really great question, and that needs to be answered. And these individuals that we spoke with, when they referenced cannabis use, they were talking about vaping. And they kept going back to, well, we wonder how many people we're seeing on campus when they're vaping. Are they really vaping marijuana, or are they vaping, tobacco? And I was like, well, yes, people are vaping still. That's certainly the case. But you might not realize that the person eating the pretzel in front of your classroom is using cannabis. And they were kind of, shocked, to be honest. They were really unaware of the cannabis product industry. And so I think that this literacy needs to happen immediately, as soon as possible, in places that are with groups that are at particular risk.
Yeah.
So college-aged individuals, right, are at particular risk for, misusing cannabis or overusing cannabis.
Totally agree. And then maybe that's the place to start, is with the people who can buy this legally, but are prone to overuse. But it's just good public health to include this as part of the conversation whenever we're talking about other things that adults can do, but that we hope children don't. But Sarah?
Yeah, I just, from that population public health perspective, which is really where I sit, I think when we're talking about media or consumer literacy training, we have to be very careful to look at a spectrum that goes from like the end user, the consumer, and a very specialized training that fits them, as well as the supply side. Because if we wander too down and just looking at the consumer, or only look at that place, we really miss a lot of groups, and we've been talking about the most vulnerable groups, or groups that are typically not included in mainstream communication. So I think that, literacy, product literacy, from my perspective, includes those direct training programs. It also includes, well, how do warning labels look? What intentions, we had a very short presentation today, but what are the norms around the perception of the product that youth are getting from advertising, and from the packaging? How is it appropriate to change, to re-examine how we're regulating that, to change those perceptions so that the other messages of the warning labels can get through? How do we affect youth knowledge, and looking at the supply side? Because if we go down only too far, we lead to inequities where some folks are benefiting from that knowledge, but not everybody.
Right. Yeah. And, I think I will think the best of the industry, and that they too are learning these things. They hopefully are interested in these sorts of findings, and that might help sort of curtail the inflow that we get. And along the lines of what Member Vollendorf was saying about working with licensing, when you have a chance, and maybe you've already, but you should see what gets rejected. It's not unlike what we see in terms of high potency THC or other things. The industry just works a lot faster than any of us are able to, and they're better capitalized than we. So they have a new product every day. They have a new advertising team every day. And our folks here have to try to respond to that and keep it cogent, right? We have to have a plan and a system that makes sense and that we can talk about. But that's really hard when it changes every day and they come at us with, okay, is that you know, a bubble font, or, you know, is that an animal depiction or is that a cartoon? Like, boy, it's just relentless. And, you know, I think the licensing division does an exceptional job dealing with this constant incoming and constant flux. So I would, you know, again, and maybe this is another step in this. How do we educate the industry to this information and say, if you're going to be submitting things to the LCB, maybe you should learn about what is appealing to children. How do actual adolescents reflect? Well, what do they say when they read these things? Member Vollendorf?
I just wanted to acknowledge and thank you, Rick, for your for your comments, David, related to the industry. You know, the one thing that I have found so far is that everybody in the industry side that I sit down and talk to can agree that we want to keep product out of the hands of young people. And I would love to explore more opportunities to bring industry to the table with us to have these kind of meaningful conversations, because I think that they're as invested in keeping product out of the hands of young people, at least from what I've seen so far. So I really appreciate that.
Could we organize something ourselves? Could we invite processors to come and hear from the researchers here? I don't know. I'll let that conversation happen elsewhere, but it's worth looking at and seeing what we could do as a catalyst for those sorts of conversations, or at the very least to send that report to every licensee so they could read it if they so choose. Kathy Hoffman, our policy manager, had a question or comment. Kathy?
Thanks, Chair Postman. I just wanted to offer the current packaging and labeling rules were written in a real collaborative effort with public health and prevention and industry at the table. And I think we tried to reinvigorate some of those conversations, I want to say about a year ago. So just wanted to offer, we've got a real great foundation to build on. And it would be great to see everybody back at the table again to continue those conversations, kind of based on what we've heard today. And I really wanted to say I appreciate the emphasis on education. I just think that's so important. It's just great to hear that sort of underscored in the presentation that you offered today. So thanks for that. But looking forward to working with everyone moving forward on this. Thank you.
Great. Thanks for raising that. Appreciate it. Member Garrett?
I raised my hand, but I took it down because Kathy covered what I was going to say, that we did bring industry in on these conversations back when we were coming up with the new packaging and label rules.
Yeah, for sure. And I just, as we get new research and new science, let's keep sharing it. It was my suggestion. Just, you know, when this started, nobody could have imagined, I can't believe anybody could have imagined the variety of products and creativity in the packaging that we see today. So any other questions for our panel? My only other big takeaway was apparently adult teens have terrible interior decorating taste if they're stapling cannabis packages to the walls, but you know. Anything any of you would like to offer in closing?
Well, the one thing I would add is we don't know actually how a real critical age group interprets this content, and that is 18 to 20-year-olds.
Yeah.
That is not included in our focus groups and is not going to be included in our phase 2 with King County, because they're primarily interested in adolescents. And so that is something that Jessica and I are working to try to achieve, because I think there are going to be differences based on developmental experiences, but also just on proximity to being able to legally use. And then of course, there'll probably be a difference for 21 and plus. But that work has not been done. And very little of this research is being conducted and being published in the academic side of things as well. So there's just not a lot of people working in this area that are looking at specifically at product packages.
Yeah, interesting. Okay, Nicola?
I just wanted to thank you for the presentation. It was great information. I think any future research is great or collaboration, and just look forward to working with you more. Thank you.
Great. So thank you all very much. Let us know how we can help do those, next steps and steps after that and anything else. So I really appreciate the work you did here and your connection and working relationship with Mary. So keep us in the loop. Really appreciate it.
Will do. Thank you for having us. We really appreciate it.
Thank you.
Have a nice day.
Thank you.
Thank you.
Thank you. Bye.
Okay, we will move to our second item, which is prep for tomorrow's board meeting and a rules update, and bring back Kathy Hoffman. Hello, Dr. Hoffman.
Good morning, Chair Postman and Board Member Garrett and Board Member Vollendroff. That's a hard presentation to follow, I will say. That was a lot of interesting stuff. So as we've been doing the last few months, I'll just provide a rule update today. I will mention it tomorrow in the board meeting, but I will not provide the same rule update in the board meeting tomorrow. So give us more of an opportunity to share more information today and ask questions if needed. So lots to update you on. October has been busy, kind of like September, and I suspect November will be as well. There's currently no alcohol rules in progress at this time as we interview to fill Audrey's position. Those interviews are happening right now, so we do anticipate that once her position is filled, we'll be able to start a larger project to update current alcohol rules based on staff feedback and requests over the last couple of years. So we're looking forward to taking that on. And Audrey's left a really great table of things that need to be updated that we can use as a launching pad for the next person coming in. We'll also begin work on rule development on the recently adopted petitions that pertain to alcohol. And just as a reminder, one explored allowing private clubs to add additional membership drives and host consecutive membership drives or both. And then the second had to do with allowing for cloud storage. It came to us really focusing on cannabis licensees, but we like to explore whether such a provision might have implications for the other commodities that we regulate. So that's what's happening with alcohol at this point. Any questions there? Kind of quiet at the moment. All right, so moving on to cannabis. Our work on cannabis plant canopy began in earnest after you approved the CR 101. That was on August 31st. We hosted our first World Cafe session last week and focused on 3 questions. Those were, how should we treat floor space that isn't in production? How might we update the tier system? And how should we measure canopy? And I'll have to say that we had far more attendees than we anticipated. There were, and I looked at the sheet that Teams produces, we had around 90 people in attendance. That's not accounting for, the team that was running the meeting. So we had 5 room hosts. That meant that there were approximately 18 people, including the host, in each room. And I have to say, this isn't ideal for World Cafe. I think if we were live, we might have done it a little differently, but being that we were in the virtual environment, we really didn't have a lot of wiggle room there. So I think moving forward, we might try to use our registration model so that we can assign rooms ahead of time and kind of gauge for how many people will be in attendance. And truly, we were not anticipating that, although we're happy there were so many. But it did create a few logistical challenges, I will say that. So next steps there is for Jeff's working that rule project. He will distill the information that we received in the harvest as part of the World Cafe. We'll determine what themes emerged and then use those to host our next World Cafe session. We do believe there will be need for an additional session on November 16th. Any questions there before we move forward? Great conversation, so, okay. With respect to cannabis advertising, internal discussions continue. This is Robert's last week at LCB, so thank you, Robert. The project will go on temporary pause for that reason until we can fill his position. So I anticipate approximately a 6 to 8 week delay on that, maybe less. as we continue interviewing for his position as well. So in new news on the cannabis side, Jeff is planning on bringing a CR 101 next month, so likely the November 9th board meeting on the petition we accepted last month on cannabis sampling. We do recognize that Canopy is a very large and complex project, but we also think that existing sampling rules have been a concern for many for some time, and we'd like to begin that before the end of the year. So thanks to Jeff for getting those two important projects off the ground for us. And then just quickly as an update on rule petitions, we did receive another petition on the cannabis side on September 29th, asking that the agency consider rules that would require I-502 stores to secure affirmative consent from consumers before scanning their IDs, and then requiring additional signage that a store might scan for IDs. So more to come on that, but Jeff is reviewing the request and working with staff on our recommendation to bring to you. And then during the course of the presentation that we just enjoyed hearing about and learning about, we received another rule petition on the alcohol side. I haven't had a chance to look at it. I think Jeff responded to it while we were listening, but they're still trickling in. So we'll let you know more about that. And then finally, I will be presenting rules for final adoption on social equity program tomorrow in the board meeting. Don't know that we need to do any additional briefing on that, but just want to throw it out to you if we do. Any questions on the presentation for tomorrow?
I don't think we need a full briefing on it. I think, and I think this is your intention, but, any even minor change we should discuss tomorrow at the board meeting and have a chance to go over that there. And of course, members might have questions. I think it's also just an opportunity for to get some clarity on parts of it that have been subjects of discussion. So, but I don't know if the other board members have other feelings about what they would like to see tomorrow before the vote.
No, I don't. But I do want to say, Chair Postman, to Kathy, you have some big shoes to fill with Audrey and Robert, and I hope you got some good applicants. And I just wanted to take a moment to thank Robert for his work during the time that I've been with the LCB.
Yeah, absolutely. Ollie, did you have something you want to know? Okay. Go ahead.
Oh, I do have, if we can move on, I have a couple of feature things I wanted to bring up for future board meetings and some additional work we're doing. But to your question, Chair, about going through just the minor changes. So in rule terminology, we call those non-substantive changes. Those are changes that wouldn't, change the impact of the original rule proposal that there was a public hearing on in September. So just want to clarify there. These are technical changes like changing a word, like for instance, from marijuana to cannabis. We added a word, the word maximum to the total point calculation in the scoring rubric, things like that. Things that don't change the way that the rules would be applied, but merely clarify or correct typographical errors, those kinds of things. So those are the things that I'll be speaking to tomorrow.
Yeah. The other thing I think you could be confident getting a question is what would our timeline be following tomorrow?
Yes. And I will answer that as best I can.
Yeah, no, understood. But yeah. Okay. And I'll ask it as best I can. But yeah, I well aware of all the variables there. It's not asked as a way to rush it at all. Just
many moving parts.
Yeah.
So I just wanted to briefly speak to general rulemaking, thinking back to Audrey, she had that CR 105 that she brought to you, that updated physical addresses. I think we had hoped to bring you that 103 towards the end of October. I think at this point it's going to be the November 9th board meeting. There have been no comments received on that expedited rule package at all. I will tell you, we weren't anticipating any, but just to be on the cautious side, we're going to extend that out to November 3rd. And then the next thing I wanted to talk about just briefly are two And these are sort of related to perhaps future policy and existing rules in progress, or in process, excuse me, existing adopted rules, I should say. But I just wanted to speak to the cannabinoid science work group. Many are aware that we started recruiting for members of that work group last week. I'm really happy to share that we've received over 20 complete applications for that from people not only throughout the United States, but in other countries as well. And that surprised me in a really good way. I was really happy to see that there was that much interest. And so we're hearing from research scientists, people in health professions, just a really diverse group of people, chemists. I'm just really happy to see the response that we received to that. And that application window does close on October 24th. So just a heads up on that. The second one was the Cannabis Quality Control Work Group that we had discussed when we adopted the rules, the new rules for cannabis quality control. And Jeff will begin recruiting for that group once we're done with the cannabinoid science work group. We don't want to create confusion by having two recruitments going out sort of one after another. We want to conclude one and then start the other. And again, just as a reminder, the purpose of that group is to talk about the effectiveness of the newly adopted cannabis quality control rules and see if there's any adjustments we need to make in the future, those kinds of things. And that completes my presentation.
Great, thank you. You know, I was glad to hear how many people came to talk about Canopy. The applicants for the science panel are great news. You know, sometimes we have public hearings on things that we all think are really big and very few people show up. But they're engaging throughout the process. And I just take that as a really good sign. And I think a validation of the work that the staff does, which is people want to come and be a part of those conversations. I worry the day when no one shows and says, you know, it doesn't matter, but it matters to us a great deal. And for those that came for the conversation about Canopy, I was not there, but we have many discussions about, you know, what people are hearing and things of that sort. It really does help us. So really encourage more of that. So yeah, I take it as a really good sign, Kathy. And just add some thanks to Robert Despain. It's been fun. He's always approaches these things with a little bit of humor, which helps me, and some great insights. Not afraid to stir it up, and always answers the questions. And so, Robert, thanks, and good luck in the next steps. But I have no doubt you're going to find a way to hone those legal skills that I know you're itching to do with your law degree. So I don't know why you want to do that, but you know.
I just wanted to pop on real quick and say thank you all.
Please,
I appreciate the comments. So thank you.
Yeah, it's been great to have you. Keep in touch. Appreciate it.
Appreciate it. Thank you.
Okay, anything else from any board members? No. Justin, anything to share?
Not today, Chair.
Yeah, great. Okay, with that, we will adjourn the Liquor and Cannabis Board Caucus meeting for October 11th, 2022. We'll be back tomorrow for a board meeting at 10, and then for an executive management team meeting in the afternoon. So we'll see many of you then. Thanks, everybody.